Ladies and gentlemen, thank you for waiting. We are now going to start the panel discussion. Let me introduce the panelists. From INED, Director Dr. Magda Tomasini, Senior Researcher Dr. Franz Melle, from IPSS, Director General Dr. Hisao Endo, Director for the Department of International Research and Cooperation, Dr. Reiko Hayashi, Director for Department of Population Dynamics Research, Dr. Futoshi Ishii, and the moderator will be Deputy Director General at IPSS, Dr. Ryuichi Kaneko. I'll now pass the microphone over to the moderator, Dr. Kaneko. Dr. Kaneko and the panelists, the floor is yours. So now I would like to start the panel discussion. My name is Kaneko. I'm from IPSS. I'll be serving as the moderator. The keynote speech and the panelists have spoke about the key points for discussion in their presentations, and in order to start the panel discussion, I would like to briefly go back to what has been discussed. First of all, Dr. Tomasini of INED talked about how France is dealing with longevity. She talked about APA, which is like the long-term care insurance system in Japan. It's the APA system in France that she talked about. And she also introduced us to the GIR scheme that is similar to the level of care required system that we have in Japan. And she also talked about the difference in people who stay at home and those who are staying in facilities, and that the benefits received are different. And as is in the case in Japan, change in demographics with aging of the society. She also talked about the projection of demographic change going forward and talked about 3 different scenarios: optimistic, middle, and pessimistic scenario. The ratio of people who require assistance is going to increase. And she also talked about the impact of the baby boomer generation, which is quite similar to what we're seeing in Japan, the aging of the baby boomer generation could trigger some issues in timing, and this is very similar to the baby boomer generation issue that we're seeing in Japan. In terms of demographic change, she also talked about the change in family structure, especially the caregivers, the care bringers. Decline could be brought about. The probability of not having an unoccupied child has also been pointed out as an issue, possible issue. Quantitative research into these aspects, the need for that was also emphasized in her speech. And then Dr. Endo also gave a keynote speech, and he also talked about the overview of a future population and demographic change the elderly population above 75 is going to play a very important role. And some of the key points that he highlighted included things like disparity among different regions. And when we look at medical care and long-term care from the usage perspective, and also from the perspective of cost, social security cost, there's a discrepancy across different age brackets. And that has a very big impact on long-term care due to aging of the society. And Dr. Endo, has presented very efficiently an overview, and I will not be able to cover everything. But he also talked about the difference in medical cost between men and women, and also about public funding into long-term care insurance, and generational migration, especially when it comes to medical cost. The type of medical service that the elderly has been receiving over the years and what the young generation will be able to receive will be different, and also if that is to be multiplied by difference in region, the importance of having a comprehensive medical care and region-based comprehensive medical care will become important. That was mentioned by Dr. Endo. And from discussants, we had 3 speakers. Dr. Mele of INED spoke of the longevity in Japan being top of the world. Who are the candidates who will take over that top position? Open Bope, longest longevity has been growing linearly, in a linear manner over the years. And from her research, she has done a detailed survey on that and said that the pace of longevity has been observed. And countries that could replace Japan, Spain, France, Nordic countries, and Switzerland. And she also said that Korea, South Korea, could be a promising country that would overtake Japan because the life expectancy is growing at a very rapid pace. And looking at the different causes of death, the pace is accelerating in South Korea. And she said that she would like to pay attention to South Korea. And Dr. Hayashi talked about healthy life expectancy, healthy longevity, and she looked at the different indices for death, and she looked at the different causes of death, communicable disease, non-communicable disease, and the places of death have changed over time. And when talking about healthy longevity, healthy life expectancy, there are numerous indices according to Dr. Hayashi. And for various health indices, she did a calculation and did a comparison. And as a result, she said that the health life expectancy is growing in the same way as life expectancy in general. And then Dr. Ishii, they talked from population dynamics perspective and talked about the longevity trends from various indices. For example, looked at sex differences over the years. Sex difference has been growing, but in recent years that gap is narrowing down. And he also pointed out a major issue, which is that if you look chronologically at longevity, there are 2 phases. Phase 1 is the decline in mortality of young generation, which creates a rectangularization of the survival curve. And in phase 2, there's improvement in the mortality rate of elderly, and he used the word delay of death. And 1970 seems to be the turning point of phase 1 and phase 2. He also talked about the death distribution index and talked about the IQR to clearly define the changes over time. So those are some of the discussions. In summary, what has been presented by the speakers earlier, and now I want to invite the panelists to perhaps give some comments or questions to other speakers, or if there is anything that you want to supplement to what you have already discussed. Maybe you can take 2 or 3 minutes each to touch upon those topics. In the order that you are seated, perhaps may I start with Dr. Tomasini?
Thank you very much. I just have a question to Dr. Siawando. Because in France we are currently living a social crisis due to the working conditions in nursing home, following the law of the adaptation of society of aging. And I asked myself, is there some difficulties in Japan to recruit people to work in nursing home, or is there some questions about their conditions, working conditions, things like that?
Dr. Endo, please.
はい、介護
Staff in caregiving and nursing homes, yes, it is a problem that exists, and it is a significant issue now in Japan. However, it is true that in the case of Japan, there is an increase in the number of people working as staff members in the long-term nursing care homes, but it still is less than the number needed. And there are a variety of reasons that are cited for this, but first of all, and I think this is a big reason, in the work of caregiving and the risks involved, the burden, in comparison, the compensation is not equal to the load and the risks involved in caregiving. And if there is a need, normally, based on market mechanisms, compensation should go up for that type of work. But in the case of long-term nursing insurance, because it is based on public funding sources, we could not adequately increase the level of compensation to these workers. However, it's not to say that the Japanese government is complacent and not doing anything at all. Once in every 3 years, compensation for caregivers in long-term nursing homes there are being reviewed. And every time, the wages for such workers are now being increased. So the compensation levels are rising. And also, it's not just compensation. There are subsidies from the government that have been used in the past to supplement wage levels, but that in itself has not been enough. And in particular, another special feature is the need for expertise in caregiving. So compared to doctors and hospital nurses, in the case of caregiving in long-term nursing homes, the staff members do not have that high a level of expertise yet, and therefore, as a result, when the business and economy improves, and there are job opportunities in other industry sectors, sometime the nursing care home staff move to other sectors and move to new jobs in other industries, and the Japanese government is taking up this big issues of shortage in manpower, and by 2020, because they know that there is a shortage, they want to be able to employ 250,000 more employees in long-term nursing homes. And basically, the type of policies they are thinking about right now is first, the caregivers in long-term nursing that left jobs, but they were working there before, they want to call them back to work again. And also, they want to invite new people, first-time workers in long-term nursing, to work. So they are trying to set policies so they can encourage students, for example, to look into that area and to study and to increase compensation, and also to make a system where the local residents and the people in the periphery can join to help. So a mechanism to help the local residents participate, and also to prevent high turnover. And so caregivers are said to be of high physical load as well. So by alleviating their load, to reduce turnover, to prevent them from leaving. Trying to develop childcare centers so that young women, young mothers can become caregivers, and using ICT to have robots help out and enhance the productivity of long-term nursing care. So not all measures have been all that successful. There are difficulties, but they are trying to improve to mitigate the shortage in caregivers in long-term nursing. And we have to monitor whether appropriate progress has been made. But these are some of the policies and measures that have been taken.
Dr. Tomasini, does that answer your question? Thank you. Dr. Mele, do you have questions for other speakers or maybe comments?
Yes, thank you. We have several questions, but the first one in order will be also for Mr. Endo. In your presentation, you were rather pessimistic about the incidence of dementia, and I was a little surprised about that because it's a big question also in France, but right now it's very difficult to estimate what is really the incidence, and especially what was the trend, because it appears that this is a disease which is much more recognized now, and that maybe some part of the apparent increase could be due to a better knowledge of the disease and a better diagnosis, and then maybe we could be a little less pessimistic for the future. I just wanted to know your opinion about that.
Thank you very much for your question. What I showed in my presentation is not just from my studies, but the study results from other researchers. And at present, by age brackets, the prevalence of dementia was shown, and how many dementia patients will be prevalent in the future. So that was one example of one research result of another person. I personally am not optimistic or pessimistic on this issue right now. However, for Japanese society going forward, it is unmistakable that the issue of dementia is going to be a problem. In that sense, maybe I am pessimistic after all. And a variety of format measures against or to mitigate dementia has been taken. And dementia was taken up only in the framework of group homes and long-term nursing care, but in the medical arena as well, dementia and early detection of dementia has been taken up more and more and discussed and studied. And not only this, how to designate official guardians to make decisions on behalf of dementia patients, and also social support schemes must be properly set up to alleviate issues related to dementia. And going forward, we as a government, they have come up with a new orange plan, and in an integrated basis, various ministries and agencies are trying to tackle the issues together to make progress, and we hope that they will make progress. But maybe it's safer to be a little more on the pessimistic side to tackle these issues. And in a irregular manner, if randomly new technology come up or new expertise comes up to alleviate dementia, all the better. We hope that that will happen, but...
If you have a second question.
Just to answer, maybe I agree. I totally agree. I don't say that it won't be a problem, and especially in terms of numbers, because of the aging of the population, even with a constant rate, we will have an increase of people dealing with the disease. But so this is just what I wanted to add. I had a question which comes from the presentation by Dr. Endo, which goes more to my. To Magda Tomasini, because something I found very interesting and a little surprising for me as a French is that you said that the problem of aging will be especially acute in big cities in Japan. And for French people, it's a little surprising because usually we have a view of aging which is more in the countryside, and countryside is more having problems with old people remaining there than the big cities. So I just wanted to ask to Magda, because I really don't know exactly about that. What is the perspectives in France on this issue, and will we also see some more aging problem in the big cities in the next years?
Thank you, France. It's an important question because, as I said, it's a country who supports social welfare and especially aging welfare. But we have only knowledge about the repartition of old people in the country, and of course there are some concentration of the older in some countries, the south of France, and other countries which have equipment like nursing home. So we don't have noticed any concentration in the big city, only the south of France, because it's a nice place to live after retirement, and a country where there are nursing home and people working in the nursing home.
はい、遠藤先生どうぞ。
私の説明がちょっと
Maybe I did not explain enough. I was not clear enough, so I'd like to maybe explain again to make it clearer. The aging population is higher in the big cities, and so the percentage of the ratio of the elderly is not particularly high in the big cities, but rather the absolute number is quite high. But the big cities, from now on, they will see a greater share of the elderly out of the total population from now on, and also an increase in the absolute number of the elderly in the big cities because of the past history.
And also another unique feature for Japan is that after the war, people who are in their 70s or more in Japan have moved to big cities after the war. With the rapid growth of the Japanese economy, the people who are now around 70 have moved to big cities after graduating from junior high school or high school. have migrated to big cities. That is also another reason. And therefore, such people have remained in big cities and now they are aging. This, I think, could be quite unique for Japan. May I move on and ask Dr. Endo, do you have a question or comment?
To Dr. Tomasini, I'd like to ask a question.
It was not mentioned, but Japan and France are both countries with longevity, and the fact that the countries have achieved longevity is wonderful. It's remarkable, but as has mentioned in our discussions, living longer will trigger needs for medical care and long-term care. The cost of longevity, how should that be paid, be borne? This is a major issue in Japan. The working age generation supporting the elderly generation, that's the mechanism that we have in Japan. To what extent could we ask the working age population to support? This is extremely challenging. In Japan, there's an increase in social security cost, and that cannot no longer be supported by increases in taxes and so forth, and therefore we're paying it with debt in Japan, and the debt in Japan is growing because of that, because of the growth in social security needs. So the cost of longevity, how should that be paid as the same kind of situation in France? What kind of discussions do you have in your country? This is the question I would like to ask. Dr. Tomasini?
We have a very similar situation in France as in Japan because of the cost of aging in general, especially. But the discussion are more focused on retirement and the question of retirement, of pensions, because in France too, the active people finance the pensions of retired people. So it's a real question, and at every election there are a plan for reforming our pension system. I think that the long-term care is seen as a problem in more far away, comparing to retirement and health system financing. So the last law taken was about I spoke about the 2015 law of adaptation of the society to aging. There was an evolution in the APA barème and also transfer between nursing home, which have more means than nursing home specialized in dependency, in heavy dependency, and that's why there is currently a crisis, social crisis in the nursing home. The question that appears at each reflection on the financing of aging is the question of patrimonial risk, because a solution can be making recoverable the APA and be taken in the patrimonial after the death of the person. It's nobody dares to take this measure, but I think it could be in the future a measure to. But if you take the patrimoine, the succession of people, it's the elderly, it's the young who pay the same question. The young generation have to support the old.
はい、よろしいですか。
ありがとうございます。
Did that answer your question? Yes, thank you. So Japan and France, the cost of aging, who is going to pay it, who's going to fund it, this is a very important point that was raised. I was thinking of talking about this later on, but on a related note, the fertility rate in the two countries are different. What I'm trying to say is that in France, amongst the developed nations, the fertility rate is quite high. The population conversion rate is quite high, and whereas the fertility rate in Japan is extremely low. It's one of the lowest. There is an imbalance of the size of population amongst different generations. Aging, longevity is the theme today, but fertility rate, I believe, has a very big impact on the path of longevity and aging. Are there any specific maybe comments from you? Anyone?
メレ先生お願い。
Dr. Mele?
Yes, thank you, because I just wanted also to add on this point that makes a little difference the case of Japan and the case of France. And I think in France we have a specific problem, as Magda Tomasini said this morning, is a baby boom generation. So this is in the now short term, this will be the problem we have to overpass, because it shows that at this time we will have some disequilibrium between the active population and the retired population. But after that, the idea is that things should be easier and better when all these baby boomers, I am part of them, will have disappeared, and then it could be easier to balance the system.
はい、ありがとうございました。
Thank you very much for that.
部長、何かありますか。
何点かコメント。Yes, I have a few comments. I have a few comments and questions, but we're talking about baby boomers and fertility, and on those points, in Japan, in post-war Japan, there was a period where there was a plunge of fertility amongst the baby boomers, but baby boomers will become late elderlies, so until 2030 the number of late elderlies will increase, but then it will flatten. However, because the total population is coming down, the proportion of late elderlies will continue to go up. So listening to Dr. Mele, I was impressed that there is a difference between the situation in Japan and France. So this is just a simple comment, but first of all, I had a question related to that point. But even in France, fertility dropped, but then catch-up effect, and it's gone up, and it's around 2 at the moment. Birth rate is about 2 at the moment. And then the number of children will be increasing because of heightened birth rate. Does that mean that there will be more younger people who will be taking care of the elderlies? If so, the number of family members who will be taking care of the elderlies within the family may increase. Is that the notion in France? Either Dr. Tomasini or Dr. Millet, can you respond to my question? And then the following point was touched upon during the discussion, and this is just a simple comment to what was mentioned. First of all, on dementia, your question was that the statistics may be rather pessimistic, but at IPSS, we invited Professor Ninomiya, who's doing the statistical survey at Hisayama town in Fukuoka Prefecture. And there's great relevance between diabetes and dementia. And because prevalence of diabetes is going up, if that is taken into consideration, we expect that the number of dementia patients will increase in Japan. So the basis is the prevalence of diabetes going up. And yesterday I talked about France, and in France, diabetes and cardio diseases, heart diseases, are coming down. So you were saying that it may be the case that the number of dementia patients may begin to come down. So the disease structure may be different. Life expectancy in Japan is long, but the timing when life expectancy began to increase was later than France. So it may be that the disease structure amongst the chronic diseases hasn't caught up with France. So from that sense, I would appreciate any clues you can give me. And then there's another comment to a comment which was raised during the discussion. In Japan, yes, it's true, we're in short of long-term caretakers, and Dr. Endo made a few suggestions, 3 or 4 suggestions on how we can fill the gap. But there's another option, and that is accepting foreign workers. And for the time being, the percentage of foreign workers in long-term care is very low, as low as 0.4%. In France, it's probably 30%. Foreigners account for 30% of long-term caretakers, so the status is different. But as we feel the serious shortage of long-term caretakers, accepting foreign workers is one idea that could be considered and factored into the policy. So technical traineeship has begun, and that is one residential status that have been newly established, allow for workers to reside in Japan. So if foreign workers obtain the qualification as long-term caretaker, they are giving a residence status. And 2 years ago, in November, that kind of new residence status was established. But the objective is not just limitlessly allowing foreign workers. They would come to Japan once and then obtain training, and then thereafter they would go to neighboring Asian countries because the pace of aging is going to be much faster than Japan in those countries. So they would go back to their home Asian countries right when the rapid aging begins to take off. And then they can introduce robotics, AI, and the Japanese techniques that they have been trained in Japan. So in that instance, foreigners trained in Japan as well as Japanese long-term care workers can be sent to Asian countries in order to increase the quality of the healthcare system in Asia. Asia Health and Well-being Initiative was the policy and strategy created by the Prime Minister's office in 2016. So that strategy has already been established. That was the comment. And then another point. I had one more question. Who, in the midst of increasing elderlies, who bears the cost? Yes, there is the intergeneration bearing of the burden. But in France and Japan, how much of the elderly's expenses is financed by taxpayers' money? In the UK, with the number of aging increasing, they are taking the policy to begin to reduce the national budget allocated for elderlies. But what about France? With elderlies increasing, dependent elderlies increasing, are you taking the policy of setting a ceiling of budget and the French government not paying any more than that set threshold? Those are some comments and questions. The question was the difference in birth rate. So in France, if the number of children increases, does that mean that there would be more number of young people who would be caring for the elderlies? And then the second question is, to what extent is the French government willing to inject public money? And are you going to earmark a bigger budget in the envelope of caretakers for the elderlies? Those are my questions to our French colleagues.
Okay, I try to answer to the role of children in the family. So I think that we can have a macroeconomic approach with the number of children, because the ratio active per inactive will be better. It will be higher. So on the macroeconomic level, it's after the disparition of the baby boomer generation, it will be we will have an improvement of the macroeconomic ratio. But it doesn't mean that these young are devoted to take care of their parents, because the situation is very different from the past. In the past, women doesn't work. Now the activity of women are the same, almost the same of men activity. There are more separation between the couples, so they need to have a full-time career to have their pension, their full pension, and they can be called to take care of their parents. So the French society has changed, and that's why we can't have hypothesis on go back to house to women to take care of their children and of their parents. It's another. But I didn't understand. Second question.
The second question is, if there is a kind of national budgetary limit, or are you limiting the budget, the government budget for the long-term care?
I think that's the question. There are some. The question of limiting the long-term care, of course, you have to be careful to the long-term care budget, but the question of limiting is not so huge than the question of pension and health budget. And that's why the most recent decision of the government is to extend a contribution, a social contribution who was only for active person before, and now every people has to pay this social contribution. We call it CSG. Before, retired people didn't have to pay it, but now they will have to pay it.
Dr. Ishii, any intervention from you? So far, I think we have talked a lot about the system, about the institution, and I want to talk more from the demographic perspective, which might overlap. I have a question and comment for Dr. Mele. In Dr. Mele's keynote speech, you talked about Wopen and Opel 2002, about the super long extension of life expectancy, and it was growing linear, had been growing in a linear way. I think there were people who were looking at it in that way, but as I said, the phase of E0 extension has changed over time, and there are discussions saying that whether this is going to continue going forward, but Dr. Mere showed in dotted lines, broken lines, saying that the pace of extension is changing. And that explanation was quite convincing, and I think it was a sophisticated way to explain. From a separate perspective, I have a question. Dr. Mere, you are a leader in the cause of death, and so towards the end, the second half of the presentation, you did an analysis of the cause of death, in which you talked about people at the age of 60, the contribution for growth of life expectancy, and you gave a breakdown by different causes of death. And I think this was an example for South Korea, where people who die from salinity is quite high. And you've done a redistribution of that and done an analysis. As a matter of fact, if you look at the cause of death in Japan, and if you look at age-adjusted mortality, right after the World War II, many people died of salinity. It could be due to wounds, or maybe it wasn't categorized as anything else, and therefore there were many people who died of salinity. But that has declined rapidly, and salinity as a cause of death is very low in recent years. But after the year 2000, the cause of death being salinity is increasing, even in age-adjusted mortality. Why is this occurring? I don't know. We can't identify the reason, but maybe things like dying of wounds and unknown. Maybe there are other reasons. We don't know. And I think we need to watch closely how that will turn out eventually. But for different reasons that we've seen in the past, when we do an analysis of cause of death, how to deal with the cause of death being salinity, we need to perhaps look into that. And you talked about the redistribution of salinity in your presentation, and when there's a growth in salinity, how could we deal with that? Do you have any methods or ways to address that? From your experience, I would appreciate if you could share that with us.
Yes, thank you for your comments. You are right. So I think there is really an issue with senility now, but not only in Japan. And maybe, so before, senility was considered as a totally ill-defined cause. So it was like that. So people put senility or old age because they didn't know about the cause, or they didn't want to know about the cause. And with the development of the countries and the improvement of the statistics, this share of senility decreased everywhere. And you are right, in Japan, I did the same exercise for the years before, and senility was still important, and we can see that it decreased a lot. But now I think we are in a new stage, and now we are again thinking about the cause of death for old and very old people, and maybe the cause senility or old age or aging is reconsidered as a possible cause of death even by the medical doctor. And for instance, in France we started to work on causes of death at very, very old age, so people who die above age 110, and looking at all the, it's part of another research project, and looking at all the causes which are mentioned on the death certificate. So not only the initial cause of death, the most important, but all the conditions which are mentioned. And this worsening of the general health status of the person and old age is very often mentioned. And this is probably the idea, as was said also in one presentation, is that for curing or curing old people, it's not enough just to cure one specific disease, but it's much more a network of different diseases, and which all of them are more or less related to aging and to old age. And maybe we should consider again senility as a real cause of death. So I am not sure that we have always, of course, in the case of Korea, it shows that we have to do something with that because we need to make statistics comparable to other countries. But in the most advanced countries like Japan now, maybe it's important to keep the category as it is and to analyze trends according also to that, maybe to mix senility and dementia or things like that, but not to redistribute according to all causes of death as we were doing before.
Thank you. Senility, yes, we've been talking about this in the past. You did not know the cause of death, so you attributed to senility. But Japan, France, when we become very longevity countries and people become very, very old when they die, you really think that they are maybe dying of senility, of old age. So it makes us realize how longevity has really become an issue. So going back to the basics, I have a very basic primitive question. And to Dr. Ishii and to Dr. Mele, I have a question. Japan, France. So we are top runners in terms of longevity. But why these two countries have high expectations, and also including Spain and other countries? Why is their life expectancy so high compared to other countries? What is their commonality, and what are the differences between the top runners? If you have noticed commonalities among the top runners, and what is the difference to countries with low life expectancy? Dr. Ishii, maybe you could start. Or any one of you. Yes. Then Dr. Mele, please.
I think she will complete what I'm saying. I have no clear answer about that, of course, but what appears is that it's really in this second phase of the transition. So after the first stage where all the progress were for infant mortality and infectious disease, and in this domain, France didn't do so well. And Japan, of course, caught up because it was very late after the Second World War. But I would say that it was rather simple with the tools that were discovered at that time. But where Japan and France were very good is in this decrease in mortality at older ages, and especially in the fight against circulatory disease. And for these two things, probably Japan, especially had a structure and circulatory disease very specific, which was quite different from the Western world, with a big share of cerebrovascular disease compared to heart disease, which were very low. And maybe it was somewhat easier because in the cardiovascular revolution, the first diseases which decreased were really stroke and cerebrovascular disease. So maybe it was some advantage for Japan. And for France too, France is well known as a country where the level of circulatory disease is rather low compared to other countries, like I spoke about Nordic European countries, or even the States or England and Wales. And this maybe helped because there was much more diverse structure of causes of death and of disease, which maybe it was easier just to get some progress for these different causes. In the same time, I would like also to say that if France is doing very well for women, it's not the case for men. So for men, France is really in the average of European countries, and was even a little rather late for men because of some specific behavior of French males, and especially rather high level of alcohol consumption until rather recently. So this is just to say that French females are doing well, but French males a little less, and quite comparable to other countries. But Futoshi, probably you can add some.
Thank you very much. There's not much that I can add to that. Is there a unique reason for Japan? I hope I can say something about that, but as Dr. Mere said at the very beginning, this is very difficult. We can't put our fingers on a particular reason. That's my frank opinion. Life expectancy extension comes as a result of complicated reasons, and just pointing out one reason is, I think, very difficult. But having said that, Dr. Shiro of New York City University is talking about life expectancy extension in Japan, and he talks about various examples, which includes following. For example, the traditional Japanese cuisine might be one reason. And hygiene and health consciousness might have been quite high among the Japanese citizens, and also some genetic reasons for the Japanese population. And income disparity correlation with longevity is often pointed out. And in Japan, I think there is more of a discrepancy of income in Japan than in the past. But if you compare with other parts of the world, it is not as significant. So maybe that is another factor that has a role to play. These are results of a study. And of course, he also points out that we cannot really explain totally. So this is an area where we require more explanation.
その場合、先ほど男性
Dr. Millet, in the case of France, you mentioned alcoholic consumption of men, but isn't wine contributing to the extension of life expectancy in France?
So some people like to say that. Sometimes it's a reason given to explain the rather low level of mortality by circulatory disease in France. But in fact, even if rather moderate consumption of wine could be not so bad for health, I would say, it appears that historically in France, the high level of alcohol were not in wine-producing areas, but much more in the north or of west of France, where people were drinking rather strong alcohol or even beer or rather ordinary wine, but it was really very bad for health. But this has now been reducing a lot, but it was really a public health problem in France during years.
Thank you very much. Well, we have to be careful about drinking too much. Dr. Ishii, in your presentation, you mentioned two phases. And both Japan and France are in the second phase where mortality of elderlies is continuing to come down and death is being postponed, and the life in the elderly age is being prolonged as a result. Dr. Hayashi's presentation also mentioned that also healthy life expectancy is becoming longer, and not just the average life expectancy. So that's positive news. Now, the life stage after one becomes old is becoming longer. For some, that means the number of years you have to spend as bedridden becomes longer. So my question to Dr. Hayashi. Your conclusion was quite clear. If it's healthy life expanding in parallel with life expectancy, can we take it as such?
健康寿命
Thank you for your question. With regard to official healthy lifespan, it is increasing, but the span of being non-healthy is not shrinking. So in the distributed material, if you look at slide 5 of my material, the numbers are shown. And so life expectancy is increasing. So that's one thing. But the span of being not healthy is not necessarily shrinking. And in some cases, it's increasing, some cases it's decreasing. But so everyone is living longer, everyone is becoming more healthy and living longer. It's not necessarily something that can be said overall. We can't be that optimistic. So if there are no obstacles in daily life, that's basically healthy. But even if there are obstacles, even if you have disease, how to cope with it while you keep on living. And so even you have one disease or multiple, how to deal with it and mitigate the symptoms so that you can live on. So overall, it's not just that people are living very unhealthy lives for longer. So there are ways of mitigating.
Dr. Tomasini, I want to ask the same question to you. In France, healthy life expectancy, is it growing in France?
So the question is one of the most important questions. Death is postponed, and more people are reaching very old age. However, we know very little about their health status because there are very few data in the survey in the survey samples about the oldest. And because health and disability surveys are poorly adapted to these old people, there are a lack of question about frailty, sensory and cognitive impairments. Computations of disability-free life expectancy show that in France, severe disability-free life expectancy tends to increase in parallel to total life expectancy, even if moderate disability increases with the lengthening of life. So, and if you ask some medicine men about the future of some disease, it's very difficult to have an expert opinion about some disease, like, as I said, Alzheimer or disease which concerns very old people. So it's an important question, but I think we have to work and to make more research to answer.
メール先生お願いします。
I just wanted to add a more question to Raiko maybe, but I think in a presentation I appreciated very much the slide 7, I think, where you show all these various health indicators, and you show how it's complex just to understand this issue of health expectancy. And it was not clear for me in the previous slide, the slide 5, where you provide official, say, healthy life expectancy official, on which health indicators it is based on, because after that you show that everything is much more complex probably than what we see in this first slide.
This here it says official. In the Health Japan 21, for the first time they began to use this indicator. So for the first time, Ministry of Health, Welfare and Labor decided to make this public. That is why it says official. And this definition of health is impact to the ADL. And that's the question. Is there impact to ADL? Comprehensive Survey of Living Condition. Since 1989, exactly the same question has been asked. And based upon the numbers obtained, the official healthy life expectation is being calculated.
はい、よろしいですか。それでは
Did that answer your question? And I would like to continue to take up more questions. Differences between the genders were brought up in multiple presentations. And the period of time where the elderly are not healthy, it's not necessarily shortening. And maybe there are gender differences related to this. Dr. Hayashi, the non-healthy period for the elderly, on the gender differences, do you have anything to add? Life expectancy is longer for women and shorter for men. And if you take the life expectancy at birth, the only one where women are shorter is Mali. So in all countries, women live longer, but men live healthy longer lives and die more or less suddenly, and women experience some non-healthy period before dying, and maybe it's genetic. This is how we are made as people, because we see commonalities in multiple countries. But if we look at the income levels, especially the women, if you will have a low academic educational background, you tend to become, you tend to have dementia. And so going forward, if the educational level are the same between the genders going forward, and when these people become older, maybe the life expectancy and the healthy life expectancy will change, in that right now for women, the non-healthy period when becoming older is longer, but with higher level of education of women elderly, maybe this will change. And in the UK and Singapore, I think statistics have already shown evidence of this trend, and I think we will follow the same path in Japan.
Dr. Endo? Earlier, you talked about the gender difference in medical expenses. and you talked about outlooks going forward. How serious is this from the perspective of addressing longevity? I'm beginning to feel that gender difference might be quite significant. Earlier I said I was showing the difference in medical expenses between men and women. It's not to just say which one is paying more. It was one of the indications that was used in order to show what kind of disease is more suffered by men or for women. That was shown, demonstrated by using medical expenses. I don't think I included any data showing that women are paying more medical expenses, but when it comes to long-term care, it's clear that women tend to suffer a higher level of care requirement because even if they live longer at higher age, they tend to have higher ratio of people who, women tend to have higher ratio of people who have care requirement. I did not show any data with regards to medical expenses, but what I said was talking about the sustainability of long-term care premium, gender difference could become an issue. That is what I mentioned. Why is it higher for women? One is because women suffer more from bone disease and therefore they are prone to become bedridden, but I'm sure there are various other views and various other reasons for that. But at any rate, in order to prolong the healthy life expectancy of women, I think this is a major challenge for us.
それではここで
Thank you very much. Then we would like to now share with you some of the questions we collected from the participants on the floor. And there are questions related to the previous point, and this is addressed to Dr. Ishii. Gender gap in the long run, it used to widen for a long time, but more recently, both in Japan and France, the gap is becoming smaller. What is the reason behind the narrowing of the gender gap? That's the question. Would you like to respond? Yes. Thank you for the question. This difference between male and female in life expectancy was touched upon already in my presentation, and I showed you the case of Japan and France. In recent years, if we look at the gender gap of life expectancy in developed nations, in the long run, there had been a widening, but from the 70s and 80s, amongst advanced nations, we began to see the narrowing of the male-female gap of life expectancies. Until more recently, Japan was an outlier, and until around the year 2000, although other developed nations began to see already a narrowing down of the gender gap, only in Japan did the gap continue to grow until more recently. But then even in Japan, after the year 2000, the male-female gap of life expectancy began to shrink, and that was shown in the diagram that I had showed you. So in that context, Japan is now in line with the other developed nations. But if I'm to speak on Japan, for the first time, we began to see this phenomenon only after the year 2000, and we have not yet been able to analyze the reasons why. On the other hand, in the United States, if we look at some of the researchers, the recent narrowing of the gender gap amongst developed nations is one of the factors is smoking, according to some research, and that may also be a factor in Japan.
はい、ありがとうございました。
Thank you. So, again, going back to basic questions. And we are running short of time remaining in this meeting. So looking to the future, Dr. Mele, in looking at Japan's life expectancy, which country is going to catch up and take over the lead as the highest life expectancy country going forward. But when we look at how long people can live, can we continue to extend and extend as we have done in the past? Is this going to be infinite extension of life? Or maybe life expectancy, it has been extended in terms of the average, but going forward, is this going to continue? And if it is going to continue, then under what type of conditions, how long can people live up to? So it may be a difficult question, and I'm sure you receive similar questions very often from different people, Dr. Mellis, so if you can share with us your view.
I think there are two phases in your questions. The two phases are, is there some limit to the human life itself, which is a real question, and we really don't know exactly about that. All what we know is that we know a French woman who lived until 122 years and a little more, and 5 months, I think, which was Jeanne Calment. This is the record right now, which was really checked, and we are sure about it. But unfortunately, there are not enough people reaching these very old ages to be sure of the risk of death at these very old ages and how it's changing. And we are participating in and Futoshi Ishii is also part of this, in some project about very old people to try to know better the shape of the mortality curve at these very old ages and to be able to imagine if there is some real limit or not, but we are still not far from getting a precise result on this question. But even if we don't know about that, and there are very few people who reach still these very old ages, the other question is the life expectancy. As you said, is an average, and this average could come closer and closer to this limit if this limit exists. And there we have still a lot of years in front of us, because life expectancy even in Japan for females, which is almost 87 years now, but if the limit is 122 years, you see that the average could, of course, not reach the limit, but could come closer and closer. In the same time, to improve and to progress in life expectancy now, we need to get progress at older and older ages. And so it means that it's more and more difficult because the progress has to be, because of the way of life expectancy is computed, the progress has to be greater and greater to have the same progress in life expectancy at birth. So this is why I think, and this is what we see more or less, that the pace of progress should probably decrease a little, slow down, but it doesn't mean that it will stop. And there is no real reason to think that it will stop in our countries. Then the last thing I would like to say is that in the recent years, and especially in France, we saw coming back more fluctuations than before. So there were, for instance, 2 years in 2015 and 2017, very recently, where there were rather important flu epidemics, which stopped the progress of life expectancy for 1 year. So it doesn't change the general trend, which remains rather favorable, but for 1 year it decreased a little. And this could mean that as now the people who are dying are older and older, and so they are also more frail, and they could be more reactive to this sort of time events, so like epidemics. Also, there was also this heat wave in France in 2003, which stopped a little the progress of life expectancy. So we could see a continuing progress, but with more fluctuations than we saw in the most recent years. So this is part of the answer.
はい、ありがとうございました。
Thank you very much for that. Dr. Ishii, the path of humans, any comments from you? Well, Dr. Mere has said it, but is there a limitation to life of human beings? Of course, there are some who say yes, some say no, and there's no right answer to this. But against the backdrop, when we talk about the growth and extension of life expectancy at birth, what has been classically said is that in phase 1, the extension of life expectancy in phase 1, it was said that the mainstream thinking was that there is limitation to life expectancy, but in phase 2, there's improvement in mortality at higher age, and therefore there is much more room for extension of life expectancy. I think that's the argument at this moment. So in terms of my answer for the question of is there a limitation of life expectancy, I would say we don't know, but I think there is still room for extension. From the speed of life expectancy in the past, I think the speed has moderated somewhat, but at this moderate pace, I think there is room, possibility for further extension.
からの質問で、メレ先生の方。
There's another question from the floor to Dr. Mille. In Korea, the poverty rate of elderlies is startlingly high amongst the OECD countries. But if life expectancy is going to be prolonged in Korea to catch up with Japan, what will be the case? Due to social factors, even with high poverty amongst elderlies, will Korea's life expectancy catch up with Japan without being impacted by such economic and social factors? That's the question.
So I cannot predict the future, that's sure. What I just tried to show you is what we observe right now, and what we observe is a very rapid increase, and even what was also surprising for me in Korea that even after the very huge economic crisis which hit Korea at the end of the 90s, you don't see any impact on life expectancy. So maybe I cannot say, and it could be if the situation deteriorates and that the progress will slow down. Is when I presented this projection, I said that it was assuming that the pace of progress would go on at the same rhythm in the future. So of course it's only a way to present things and to offer some possibilities for the future. But right now I am not a specialist of South Korea, and I think it would be very interesting to think of all these trends with South Korean researchers, probably to know a little better the situation of the country.
はい、ありがとうございます。そろそろ。
Thank you. The time is quickly running out. Last comment, final remarks by each one of the panelists going forward, life expectancy in the future, and some of the systemic issues, countermeasures, and also direction of research in this area, as well as proposals, recommendations for policy. Each of the panelists, we'd like to ask you to give your final remarks. Dr. Tomasini, if you could go first.
Just wanted to complete the discussion on 2 points. For my first point concerns the gender gap and the fact that in France, like in Japan, the disability-free life expectancy is only slightly higher for women than for men. We mentioned, of course, the question of of education, which is very important to explain the disability. But there are recent research from Emmanuel Cambois at INED about the burden of the working conditions. And it shows that the fact that women have more often in France working conditions more difficult can explain the fact that that there are more incapacities when they're getting older. So it was my first point, so the question of education, but the career is important to analyze the life expectancy without disability. And my second point was about the fact that we nowadays is postponed, and disability and dependence are now quite frequent. So I think that more attention could be given to the consequences of the disease, or more simply of old age, to the disablement process, and to factors increasing the risks of dependency, such as poor nutrition and physical activities, poor cognitive and social stimulation. In France, many people are exploring the possibilities to use new technologies to help to meet the needs of the dependent elderly people. This could be an important axe for the research in the future.
お願いします。
Please.
Very shortly, again about the gender gap, but more from the life expectancy point of view. Futoshi Ishii showed very clearly how there was this reversal in the gap between males and females for life expectancy at birth. I just wanted to add that it's not the case at all ages, and especially at all ages, and especially at old ages, where life expectancy at age 80, for instance, in France, and more even in Japan, the gap is still increasing between males and females. So it means that mortality is decreasing more rapidly for females at these ages than for males. So once again, I think females are showing the way, at least for mortality issues, and so it would be very interesting to follow this point in the next years.
はい、遠藤所長お願いします。
はい、
Dr. Endo? Yes. In the discussion, how long can life expectancy expand, and healthy life expectancy was also mentioned. A very simple question popped up in my mind, and I wish to share this with you. In the case of Japan, healthy life expectancy is evaluated in very subjective manner, and facilities are outside the scope, so the sample is very limited. But even then, from 2001 to 2013, if we look at the relationship between life expectancies and healthy life expectancies, there's not much change amongst male and female. My point is, if average life is going to be prolonged, there could be an interval, but is healthy life also going to be prolonged? And can that be assumed looking at the indicators of other countries? Because if that were the case, of course, with life expectancy increasing, then the number of elderlies will increase, but it's not necessarily the case that medical cost and long-term care cost will continue to increase in proportion. So what about average life and healthy life expectancy going on, and what would be the difference thereof? That's the area where I would be very interested in to see.
Well, first of all, life expectancy is high in France, but once the baby boomer generation issue is resolved, balance can be resumed. So that is completely different from the situation in Japan. And healthy life expectancy becoming longer. We have done a study called REV with INED, and there is an international network in this area. So the effect of daily activities, certain factors will extend life. This has already been proved. And Dr. Endo, with the increase in medical care expenses, there is an increase regardless of the age bracket. And this is not necessarily a bad thing. Maybe this is indicative of progress of mankind, and new technology needs to be developed. So other factors will increase as a part of expenditure, but as a result of those expenditure, mankind may end up living longer. In the case of Japan, by people living longer, maybe we are making up for the low fertility rates in Japan, perhaps.
はい、
In this seminar, well, this is a seminar, but this idea originated from a longevity project that we have in IPSS, and it played a very important role in making today's symposium possible. And Dr. Mere had been supporting us, and with regards to study on the cause of death and international standardization project, we collaborated with the French team on those aspects. And today, we've had a lot of discussions on longevity, and both Japan and France are quite advanced in longevity, but there's a lot that we still do not quite understand. The experience of both countries should be, I think, analyzed and studied, and I think it's very important for us to do that. That's what I strongly felt today. So joint in collaboration with INED on that front, and also the multi-cause data can now be used in order to do analysis of cause of death. So I hope that we could deepen our research in this area.
それでは時間となりましたので。
Thank you very much. So the time has come to close our panel discussion session. Thank you so very much. I'd like to ask Dr. Kaneko, Deputy Director General, and all the panelists would like to thank you very much for your efforts.